Tech Talk Tuesdays is a series of bi-weekly conversations all about engaging thought leaders, experts, researchers, and healthcare professionals in conversations surrounding the advancement of technology and health sciences. We're happy to have Heather and Brad here today with us from HCW Hosted and Jessica with Arizona Forge, who's going to be doing their introduction. With that, I'm going to turn the time over to Jessica, and there will be time for questions at the end and further discussion.
Thank you, Caitlin. We at Arizona Forge are so happy to have University of Arizona Health Sciences as a partner, and we're so glad to collaborate on this Tech Talk Tuesday. Like Caitlin said, my name is Jessica Suskind, and I'm the outreach manager for Arizona Forge. My background is in program management in the social services industry and also community development. In addition to running our Forged at UA programming here at Arizona Forge, I'm also the on-campus event manager and co-director of 10 West Impact Festival, where I have the opportunity to work with over 60 organizations in Tucson to put on an annual festival focused on impact, innovation, and entrepreneurship mostly. And I just really love that my role with the university allows me to build the community and work on dynamic events and experiences. Arizona Forge, if you don't know, is a new unit under research, innovation, and impact here at the university, and we are looking to find opportunities and resources to grow entrepreneurs. We have 3 different arms of our unit, and so we work through Forged at UA to inspire and cultivate entrepreneurial thinking in students on campus. We're looking to advance the entrepreneurial ecosystem at large through our location here downtown at Forged at Roy Place, and then we also are hoping to drive scale up and launch acceleration through our startups like HCW Hosted through our program Forge Ahead. So our Forged at UA program has a year-long calendar of events that are looking to foster innovation and entrepreneurship for students on campus. We just launched our first student innovation challenge, the Bear Down Mask Up Challenge. And that is our kickoff to a year-long of events. In the fall, we focus on innovation, and in the spring, we focus on business modeling. And then here at Roy Place, we have our location in downtown Tucson, where we're focused on digital health and resilience. We have a startup accelerator, experiential education opportunities for students, as well as corporate innovation, and also an event space downstairs that will open as soon as it's safe to do so, and we would love to host events for you. And then we have our accelerated entry program, which is an early stage seed accelerator that has 8 weeks of business development programming that teams like HCW Hosted go through to work on their ideas and work with mentors and other startups to really move their business forward. And then from there, we run that cohort 3 times a year, and then we invite teams to become residents of our Forged at Roy Place location. We currently have 5 teams that are residents here. So we have HCW Hosted, who you'll hear from later, Stackhouse, ELE Optics, Earth and Scintillation Nanotechnologies. Specifically, HCW Hosted is an investment protecting all frontline medical staff and their families, allowing our region to maintain an active workforce of skilled healthcare workers for the duration of the pandemic. I feel really lucky that I've gotten to see HCW grow in the 8 weeks in the 8 weeks of the AEP, and since they've really been working since March, and we get to work really closely with Brad, who's the CEO and co-founder of HCW Hosted. What a hard word to say. And he's an experienced clinical emergency physician and nonprofit executive committee member with experience working in the hospital and healthcare capacity internationally. He's a graduate of the Oregon Health and Science University and the University of Connecticut and the University of Utah, and he's passionate about clinical emergency medicine, clinical implementation science, and medical education. And then we have Heather Dreyfus, who is the Chief Experience Officer and co-founder of HCW Hosted, as well as a research associate at Northern Arizona University. And I'm gonna turn it over to them so we can hear more about their business.
Hello and good afternoon. Let's see if I can share the screen. All right. All right, so I know I can't see your faces, but anyways, I just want you to be thinking for a second. Think about if you know somebody that's been affected by COVID-19. And if you have your picture up, go ahead and raise your hand. Thank you. Perfect. Yep, you can use the little emoticon at the bottom. All right. And now think again, do you know any healthcare workers? So nurses, respiratory therapists, environmental health services, any physicians, any healthcare workers that have been affected by COVID-19? Thank you, Cassandra, Kaylee, yeah, Caitlin. Okay. Wonderful. So it looks like some people definitely have an idea of how it's affecting people, especially the healthcare workers. In case you're not familiar with the direct story, I'm going to go ahead and take some time to share a story about a healthcare worker. All right. So this is actually a collage of all the healthcare workers that have been lost to COVID-19 so far. So for example, Sarah works in environmental health services, right? Her job is actually to clean and sanitize the facility. If this can't be done, the whole entire facility is stopped in its tracks. So at this point, she's been wearing the same mask for over a month. How many times do you think her mask should be worn at baseline? All right, basically once. So to get a new mask, she has to talk to her supervisor. Her supervisor works a different shift, so they barely see each other, and she's really hard to get a hold of, all right? So Sarah carries this fear of spreading COVID-19 to her family at home. Now, she lives at home with her elderly parents. She also lives at home with her immunocompromised son. And this has been a fear that she's carrying with her every day at work and on her way home. So the wonderful thing about HCW Hosted is that with working with us, she's been able to find alternative quarantine housing to protect her family from spreading COVID-19 to them. She's been able to find peace of mind in the daily monitoring, knowing that somebody is looking at her, checking in on her to make sure she's okay. She also gets to feel the comfort of the opportunity to participate in peer-to-peer coaching, which is something we'll talk about a little bit further in a minute.
So most of our healthcare frameworks and management have really been moved towards triple aim in around 2007 by Don Berwick and the Institute for Health Improvement. And really, since about 2014, really recognition that the care team's well-being and having your clinicians, having your nurses, having your respiratory therapists, having your healthcare team be well enough physically and emotionally to care for patients is especially important for each of the parts of the triple aim, the patient experience. And most everyone, if you've seen a physician or nurse practitioner or somebody, you've gotten a survey about the patient experience, thinking about population-based health and making sure that we're addressing our vulnerable populations appropriately, and then finding ways to reduce per capita cost. And again, all that's incumbent upon having a healthcare team that's well. So the metrics for wellness, what are they? What do we actually have in place for us now? There's questionnaires that go out occasionally from employers, but there's not really been the mandate or the structures put in place that really are tailored to healthcare workers' feedback or needs. And some healthcare workers or some of our colleagues feel that what is out there is largely performative, and that can be traced back to the significant increase in a number of administrators over the last 30 years that aren't actually clinicians, who aren't on the front line and understanding how changes in healthcare and limited access affect the ability for healthcare workers to cope effectively. And that's especially bad, obviously, during a pandemic. And then, of course, with the defunding of public health and pandemic preparedness over the last 4 years, they left us in a very vulnerable position without PPE that we needed, without a mandate for hospital and long-term care facility operations, et cetera, to be able to deal with surge or to make sure healthcare workers are well cared for. And as we're saying, the healthcare well-being is of crucial importance. Having a high level of well-being, you have more of an excellence in patient care. You have more members of the healthcare team who have high levels of compassion instead of compassion fatigue. You have more consistency of service. You have more dedication to the employer, the operations, and to the communities. And so you end up having more of a professional healthcare environment. When well-being is low, when you're stressed, when you have compassion fatigue, when you're worried about your sick family or getting your family sick, you're going to have lost time at work. People are going to be more likely to call out, which means costs go up for finding temporary workers or bringing in traveling nurses, et cetera. Your efficiencies go down significantly operationally. You're not able to run your revenue driven services. You have increased attrition, people retiring early or deciding that the risk outweighs the benefit of being in healthcare and being at the bedside if they don't feel like they're being protected. And then of course, whenever you have regulated healthcare, you have to think about fines, violations, et cetera. And those are more likely in times of high stress and low wellness. And there's significant data to support that. So thinking about the contributing factors to the healthcare workforce shortage, which has been long-standing at this point, is the aging population. People have not been aging faster. We're just starting to realize the demands on the healthcare system and the utilization of healthcare as people age. You have an aging healthcare workforce. Looking towards nursing literature, the mean age is late 40s to 50s, which means we're looking 10 years, 15 years more of service, and we have not scaled significantly the clinical training programs in nursing and medicine, et cetera. There's increases in chronic illness and chronic disease, which of course, not only do you have an older population, but you have many more demands and there's a lot more complexity in care, and especially with acute decompensation, as I see in the emergency department of those chronic care issues. And then as we were saying, the limited capacity of education programs. You can start more medical schools, but if you are not going to also increase the number of residency and specialist training programs, you're not really increasing our capacity at all. Also, clinical rotation sites, whether it be for nursing or for other healthcare workers, are also limited.
Just as Brad was saying, right, there's already this shortage of healthcare workforce. And so on top of that, first of all, I do want to state the data that is out there is based on nurses and physicians. But I really want to be clear that the healthcare landscape is much larger, right? You have nurse practitioners, you have respiratory therapists, you have environmental services. So there's a lot more people that should be accounted for, okay? So with the work care shortage, we also have this percentage of burnout. And this is pre-COVID, so pre-March, this is all before then, with 52% of physicians and 41% of nurses are experiencing symptoms of burnout, all right? And then we're gonna talk next about the cost of burnout, right? Once again, this is pre-COVID. So just looking at hospital cost, you have the burnout of nurses coming out at about 9 billion, and the burnout for physicians coming out at 1.7 billion. Then if you think about the total healthcare system, there's altogether about $31 billion per year that are spent on, or that are the cost of burnout. So if we were only to reduce burnout by 10%, we could save $1 billion per year.
During pandemic times and from previous pandemics, where they're talking about SARS, or you're talking about H1N1 or Ebola, there's very predictable issues for healthcare workers. Obviously increased susceptibility because of proximity to patients and duration of exposure. People often like to think about those of us in the acute care setting in the emergency department, where they're putting people on ventilators and doing aerosolizing procedures. But I really want to also draw attention to long-term care facilities, where you just have the very intimate care of at-risk patients and relatively low levels of support services for their staff. So coronaviruses have a range of clinical manifestations. We think of the pulmonary failure, the respiratory failure most immediately, and so when you divide your clinical spaces up into COVID suspected or not, there is a lot of crossover, and you find patients not infrequently who are either minorly symptomatic, maybe had a little bit of belly pain, who then have a positive test, or people, about up to 40% of people who are asymptomatic from COVID actually can be already transmitting the disease. And then of course, PPE has been limited because of national stores and distribution issues. And then of course, the breakdown in supply chain. The psychological impacts of the stress, anxiety, depression, sense of helplessness, compassion fatigue, and leading to the burnout and moral injury that eventually leads to attrition. And my experience with this in the actual workplace is where us having nurses and staff and colleagues talking about actually leaving medicine or not coming in a day because they need just a personal health day, which means the rest of the system and rest of the team is stressed. So this all leads to increased costs. So the workforce shortages are significant costs because of decreased operations. Also, because the cost of onboarding a new team member is about 1.3 of a whole FTE on the nursing side. On physicians, it can be significantly more expensive just because their work is driving significant revenue. You have the overwhelmed health systems with the large patient loads, the higher acuity and workforce needs, limited critical care resources like ventilators, medications, beds, et cetera. And then you end up having to settle for lower than typical standards of care. In Arizona, we had the emergency declaration earlier in the summer. Delay of non-pandemic care. In West Africa with Ebola, more people died from non-Ebola illness, chronic illness that was not addressed with their typical high blood pressure control or maternal child health morbidity and mortality was significantly larger. With SARS in Toronto, it took about 9 months to clear the backlog of unmet health needs, cancer screenings, cancer treatment, et cetera. And then obviously all that's leading to worse outcomes. And worse outcomes isn't just important for patients and patients' families, but it also affects the entire economy of a community or entire economy of a country, which is something we've been speaking about quite a lot.
And so then this brings us back. So that's all pre-COVID. And then that's bringing us back to, right, we're sitting here in Arizona. We're watching what's going on in China. We're watching what's going on in Italy. And then we bring it a little bit closer, right? We first see lots of cases popping up in New York. So you have the pandemic here. And we're starting to hear from our healthcare worker friends in New York. They're calling with tears, totally stressed out about what they're doing. I'm breaking down like I am right now. But anyways, so it's that feeling that they're having. And we were in a position where we actually were supposed to go to a conference at that point in time in early March, but all travel was canceled. And the conference was actually about bringing awareness to the power of stories in healthcare workforce. And it was kind of a gift, right? We have this time where we're supposed to go do something, but we're not. So we had this time to really think about, okay, this train wreck is kind of coming our way. What can we do? So we ended up reaching out to partners, right? And first of all, we're reaching out to our social circles. We're reaching out to medical anthropologists that we know. We are reaching out to some epidemiologists. We're reaching out to public health people we know. We're reaching out to people with cyber and talking about big data. And within 1 month, we had 30 people willing to really commit time and energy into doing something. And so we were thinking, what can we provide? Who can we assist? How can we do this? And how can we also involve the community? So community mutual aids to be a really active part of this solution.
To really create a community-based pandemic preparedness model, because we hadn't seen it in everything that we've been reading, everything we've been hearing, and that's been one of the missing links. So as Heather was saying, we were speaking with colleagues, and notably Beth Jacobs, one of our epidemiology colleagues who was involved on the front end, had one of her Chinese colleagues reach out and really trying to convey what they were seeing. And this is before all the data was out, when we're still wondering what was actually happening and what their mitigation procedures were, and as well as the psychological stress and the impacts that was having on their operations and how they can actually take care of patients. And what's been found is about 90% of the healthcare workers reported the symptoms of burnout, depression, compassion fatigue, et cetera. And the implementation of the peer facilitated emotional support and mental health supports was eventually found to be very useful in actually reducing those impacts. So it'd be something that we wanted to focus on and create the monitoring systems for the folks who enrolled with us to support our communities. Housing for the healthcare workers and a safe quarantined way was one of our first areas where we were trying to figure out, how do we do that effectively? How do we partner with our community? And when I say our community, local businesses, the national hotel chains, et cetera. There were services being offered all over the place, but not in a coordinated way, and definitely not connected to the healthcare workers who would make use of it effectively and helping them navigate that. In China, it showed that widespread PPE testing and tracing, and then providing safe quarantine is both viable and beneficial for getting ahead of the pandemic.
Right, so then basically at this point, we launched in April of 2020, and we have this initial proof of concept, which is really focused on healthcare workers. And I want to say this up front, we are very user focused, right? So we were just thinking about healthcare workers, how can we help the healthcare workers?
From our perspective and from our colleagues' perspectives.
And as Brad was saying, in China, right, they realized that if you can quarantine healthcare workers, that actually mitigates or stops the spread of COVID-19. So we really wanted to make that one of our first priorities. So we connected with some community partners, and we found out where there were certain hotels where they could get housing. We also had people who donated housing. We'll get into that in a second as well. And then we worked with people from the epidemiology and psychology department to come up with this daily monitoring, which is going to be looking at physical and emotional health. And this ends up being either a once a day text or a phone call that reaches out to healthcare workers, just checking in, how's your sleep? How's your stress levels today? And this is just something that they fill out. It's a couple minute survey and they send it back in. And then the third piece is really that emotional support, seeing what was happening in China and in Italy. Without this emotional support piece, people were falling apart, literally. So that was a really important part that we put in our services, to have these 3 wraparound services working together. So this is kind of, if you go to our website, hcw.org, this is what it looks like. So there's a button where you can get services, and you can kind of read through the screen and see what services are available. We definitely started pressing hard with getting housing, right? So that's where healthcare workers can register for housing. They can let us know what they're looking for, whether that's an Airbnb type situation, a hotel. And then we also have a button that's for providing housing. We're also asking community members if they have a spare Airbnb they weren't using, or if they wanted to provide housing space for free, that they go ahead and contact us so that we could link them up with a healthcare worker that could stay with them.
And I just want to interject, this whole process was our ability to kind of means test our ideas and understanding of what is useful and what is not. And so all of our participants and our, I think 160 people who've been using our services have been weighing in on what's helpful and what's not.
Yep. And last but definitely not least, we also have some family support that is available for participants and family members. And just kind of thinking about, currently healthcare workers like Sarah, the story we were talking about in the beginning, they've been finding out about HCW Hosted through word of mouth, through the website and through social media, Facebook, Instagram, Twitter. And basically right now, the majority of the people we've been helping or been hosting have been 60% nurses. And then the rest percent, 15% is other, and goes to respiratory therapists, medical technicians. Some people were residents working in the hospitals. Some people were student nurses working in the hospitals. And then we also have pre-hospital or EMS providers that we've been assisting as well, and a couple social workers. So it kind of runs this whole gamut of different healthcare workers.
So as we were developing this, we ended up putting together a few pieces in the local press and being interviewed. And really, again, we're always means testing our ideas. Our team is at this point 30 or 40 people. And we had some of our very senior faculty from medical anthropology and public health and medicine to come together and essentially write an op-ed about how we can end up doing this and recruiting more support. And this also led to a piece in the Washington Post. And it was all about how this affects our kids and how kids cope. And I was living in Airbnb. I moved back about 4 weeks ago, but I was gone for about 5 months, not living at home. And it's obviously, as you can imagine, hugely stressful. And so we need to be able to create the supports for that. It brings us to SEED. Forge a SEED Accelerator. Fortunately, just having spent some time working with Eller and McGuire Center and become more familiar with the entrepreneurship component, I realized that we have this think tank. We've got this wonderful group of academics and community members. We need to give this shape, and we need mentorship to do so. And so that's why we applied for Forge, and it's been incredible. The evolution of our ideas, not just thinking about the users, which that in my mind that should be an assumed, but who is this creating value for? How do we actually create uptake and interest from organizations or structures that have vested interest in supporting this? And mind you, we've been doing everything totally on volunteer basis with probably over 10,000 hours worth of donated time, but we need to make it sustainable and scalable. And so working with Forge, who's partnered with Village Capital and uses their viral pathway, we're actually able to build a more of a business mindset, or what I like to think of as actually social venture, because we want to be able, and we are going to be able to measure the social impacts, because it's not about the money, it's not about the revenue, it's about the impacts in our communities, our healthcare workers, et cetera. And then during Forge, I had that string of shifts I mentioned where we had huge increases in patient load due to COVID, and then also decreasing staff services, which means we had empty rooms in the emergency department and a waiting room that was full of very sick people. And so we ended up writing the op-ed in New York Times, which just set off a firestorm internationally, in fact, of interest in trying to figure out how do we actually do this, which then led to identification of partners. And this is through Paul Barish, who is one of our hosted colleagues, and then Mark Nichter, who they're both work with health sciences and anthropology, and really with WIS focusing on an international level and creating the financial drivers to be able to support good health and well-being. Having the focus be on healthcare workers is a high priority of theirs. And so we ended up participating in a panel for their summit and ongoing conversations about how to partner moving forward. This brings us to what's really culminated from our work with Forge and where we're going. So taking the understandings and the learnings that we've gotten from providing service to healthcare workers, building a paradigm from our customer discovery and understanding what, especially nursing homes and acute care health systems want to need, what are their pain points, where are their costs exceptionally high or unacceptably high, especially if they're employing traveling staff for 250% the cost of typical employed staff, et cetera. So we decided to create we're in the process of creating a 2.0 platform that is much more healthcare system focused and creates dashboards for the employers, the HR offices, et cetera, in addition to their user interface. So it's customer facing. We obviously maintain our user facing platform. And then obviously we need to be able to address our internal operations, especially as we move towards replication and scale. This is just a demonstration of what an employer dashboard might look like in its rudimentary form, really monitoring the number of their employees that are enrolled, absentee rates and attrition, how that actually falls off when hosted services are rendered. And this was based on 125 local long-term care facility workers, this modeling. And additional components that would be on here would be metrics for looking at burnout and compassion fatigue, et cetera, that helps us better target our services. So breaking down our services with regard to housing, we have the features that are safe and affordable housing. The benefits to employers, we want to be specific about having well-rested and more efficient workforce. Obviously, employee benefits, we've kind of touched on with just the capabilities of protecting them and their family and having an increased level of resilience. The physical wellness services, daily monitoring, biweekly wellness surveys, the ability to add on, and we have potential partners for testing and then for telehealth for when our colleagues do get sick, because it does happen, and making sure that there are appropriate services to meet their needs. The employer benefits, honestly, just a peace of mind that our employers as healthcare workers are actually attending to our needs, trying to make sure we're as healthy as we can be, that our morale is high, that compassion fatigue is low, et cetera, makes it so we're less stressed, have fewer medical errors, and even better documentation, which healthcare administrators will tell you also leads to increased revenue generation, et cetera. On the employee benefits side, the peace of mind is huge. And then increasing the efficiency of return to work. If you have a sniffle, you might get tested. It may be negative, but there's still 14 days that you're not able to be there, that your employer has to pay a much higher rate to have someone in your place. If we have testing that's tied to that, you may not have COVID. You may just have another seasonal virus that families are very familiar with, we're all familiar with. And then obviously the emotional health and wellness component, both identified for the employers and the employees. Really at the heart of Hosted, it's not, Heather and I may have started catalyzing it, but really it's been an incredible, unparalleled professional team of colleagues. Our COO, Patty Herring, came out of retirement to work with us and help create a new model for ensuring that our community has what it needs as far as healthcare workers being supported so we can care for the health of the community. And to me, that's exceptionally important. We have our medical anthropologists, we have our health systems researchers, and partners in the community. And that's ever expanding. The way we've used our Facebook, Twitter, and social media pages has been much more on the side of advocacy. Healthcare workers, as I'm sure you've read in the common literature, are often very scared to speak up. And it's not even just that we're being asked to speak up against our employers, but just to be able to tell the stories of what we're going through so the public can better understand and our communities can better understand. And so we've utilized our Facebook and social media presence to be able to share the stories anonymously. And to move towards an advocacy presence. And the Healthcare Citizen Pledge is our latest component of that, whereby we recognize that masking reduces transmission, will end up leading to us getting through the pandemic more quickly. Testing, treating, getting a flu immunization, all of that will decrease the likelihood that we are going to have this huge tidal wave this winter that many of us are concerned is going to break the healthcare system and lead to further economic downturn for our communities. So we have the QR code. Please go ahead and scan it, take a look, sign, and share the pledge. The point is to actually have a large enough base, and I think we're approaching 2,000 people who have signed the pledge, which then we can put in a nonpartisan way to our national leaders and our state leaders to rally around more thoughtful health policy to support our communities. Anyway, thank you very much. It's been an honor to work with Forge. It's humbling to work with an incredible team. And thanks to Heather for all the support as I've been on the front line.
Thank you. I think that's what we've got for sharing. I'm gonna go ahead and
Thank you so much.
We're open to questions.
Yes, we have some time for questions. If people just want to jump in and ask, I'll also monitor the chat if anybody wants to submit via there.
If no one has questions, I've got one that I'll preemptively address because it was brought up in Forge in a very, I think, thoughtful way. But I want to give other people the opportunity first.
I think go for it. We haven't gotten anything yet in the chat, so if you want to.
Okay. So as we're all employed, or all of us who are employed in our health care system know there are employee assistance programs. There are other services that employers feel like that they are offering, and they feel like, okay, so why do we need Hosted? Like, what is the benefit? And really being able to articulate the benefit of being user-driven And then especially to start and better understand what's wanted and needed and used, and allowing for real-time feedback so we can continue to evolve our services in a given area, regional area, to meet those regional needs. And then really creating the ability to provide that data back up to the employers so they can increase their efficiencies in a way that has a firewall or barrier between the patient or the workforce's privacy and their employer, because we've totally blended that division between home and work, right? What's going on at home with a sick family member with COVID affects you at work, but you may not feel comfortable saying that because of any number of types of stigma that might come with that. Or if you're struggling, our emotional health burden in physicians is huge. We have twice the rate of suicide as physicians as the general public, and depression otherwise. People are not necessarily going to report this directly to their employers. And so finding ways to provide services and provide input on what else could be made available is exceptionally useful. And bringing in the linkages to the community. And really, fundamentally, I think a lot of us were humbled by how the community in April and May and June really wanted to support our healthcare workers, but there wasn't there was no one to actually coordinate that. I didn't need half off. None of us need half off on our Taco Bell, right? That's just leading to us being in the health system because of chronic health issues. But so how can we educate those structures or organizations, local community groups that want to provide services to actually the healthcare workers and close those gaps?
That's awesome. So we have a question that got sent in via the chat. It's from Timothy. He says, what does the potential for growth beyond the Arizona community healthcare community look like?
Thank you. If it's okay, I'll run with this, because
Yeah,
from the very beginning of this, working especially in capacity development internationally, anything that we're building, we want to make community-based, right? So every community is different, has different resources, whether we're talking about housing resources, whether we're talking about needs or what are norms, and thinking about the cultural and medical anthropology component of it, which is why this has to be transdisciplinary. We need to create a platform to do that. I had colleagues from across the African continent and Southeast Asia being like, hey, can you share it yet? Can you share it yet? And so really not just thinking about structures that would work for us, but they can be, and I like to use the Jeep metaphor, if we create a tech platform where you can bolt on your optional components to fit the local needs, and you have a community-based group of stakeholders that want to make sure their healthcare workforce is healthy enough to care for the community, you create this model whereby top down and bottom up can meet in the middle. And so HCW Hosted will have as an organization is a 501 is filed for 501c3, but we're incubating a social venture model. So we can provide the consulting, we can provide the tools, we can facilitate and provide lessons learned in different communities to help ensure the resilience of the healthcare workforce and health of the community.
That's great. I have a question as well. So as you're going through this journey from taking this idea into a startup model, if you were to talk to other healthcare workers or healthcare professionals that want to take their idea through a startup, what was the most valuable piece of information you learned on this journey?
You go first.
You don't have to know much. I think the biggest piece is to surround yourself with a team to fill your gaps, right? I'm coming from public health. This has turned to a business thing. I call myself a business toddler. I really don't know what I'm doing. I'm still learning. But it is surrounding yourself with a team of people who are experts. You know, we keep talking about these anthropologists. We have a health economist now. So it's really, what are the gaps you have in your current team? And how do you go about filling those gaps? And I'm going to say, honestly, like if you can find people that are really, really organized and can are task driven and can help you stay focused.
Operations people.
Yeah, operations people, Patty, Britt. They've been absolutely amazing because we kind of tend to get all over the place. But to have someone also bring us back to, all right, this is what we're doing. Here are the small tasks that need to be done to get us to where we want to go. That's been absolutely amazing.
So yes. And I think not being afraid of having a vision, I think having the humility, the cultural, whether it be cultural between different professions or different areas of a university and community, and having the humility to be educated by your colleagues, I think is huge. It means testing ideas and assumptions. I mean, if there's one thing from our Forge customer discovery piece, is that you really have to question the things that you don't even realize that you take for granted. Who's it going to be of value? Why? And part of that has led to, so let me back up. So the metaphor we've used a lot, is we've been building a plane while we're flying it, while we're writing the construction manual and the flight manual. And what the process has also taught us is if you look at the larger system, there's not really been the mandate for employers to meaningfully care about the healthcare workers. I think a lot of us feel like have been dispensable, we're cogs in the wheel. And when you're able to work with a health economist to really articulate what those costs, those hidden costs really are to employers and to the system, it becomes much more relevant of, okay, we stand to maybe reduce burnout rate and cost of that $31 billion by 10%. That's a pretty humble number, and it's still $3.1 billion. And so then you kind of have your market share. And so working with an organization like Forge, which helps really draw out the ideas, workshop the ideas, and coach has been very useful. And our team, as Heather was saying, really, we have to make it fun. So whatever you do, like, you can't take yourself too seriously all the time, even if you're working on serious projects. And recognizing that you need to be values driven, meaning you need to surround your people with people with similar values around why you're doing it. And Simon Sinek has this great book, Start With Why. I recommend you read it for anybody who's really thinking about it. And it does take 120, 130% effort. It's exhausting, but you're making a difference. So go for it.
That is awesome. Thank you both. Do we have any other questions before we wrap up this session? All right, I think that's it. Thank you, Heather. Thank you, Brad, for your talk. And read the chat. You got a bunch of thank yous from different attendees for the work you're doing. Jessica, thank you so much for your introduction and for this partnership with Forge. To any attendees out there who are interested in more of what Forge is doing, I really encourage you to reach out. It's a great resource.
We want feedback. Like, welcoming feedback is something that is the most valuable component. So please reach out. We look forward to working with anybody who's interested or just even receiving your feedback. And thank you.
Awesome. Thank you. And this talk will be uploaded on the Arizona Health Sciences YouTube page if anybody wants to go back and revisit it. Thank you guys so much, and everybody have a great afternoon.
Thank you.